Okay, this is for the NG checkoff. The first thing is the positions. NG would be in a high Fowler's. For comatose, it's semi-Fowler's. And then for spinal neck injuries is in a reverse Trendelenburg's position. Before I go in, I'm going to make sure I have an order saying that I can do the NG2. And then I'm going to check my patient's chart for any allergies, anything that would affect the procedure, diagnosis. Then I'm going to knock. Hello, Mr. Smith. My name is Laura. I'm going to be your student practical nurse today. We're going to be doing a placement of an NG tube ordered by your doctor. It's a small tube that goes through your nose, down your throat, and into your stomach. It will help with any discomfort, vomiting, nausea that you have. Is that okay to do now?
Yeah.
Perfect. Okay, I'm going to do my hand hygiene and get my gloves on. The procedure is going to take us about 15 minutes. Can you give me your full name and date of birth, please?
Jerry Smith, 10/20/1946.
Perfect, thank you.
You're welcome.
I'm going to raise your bed, and we're going to get some vital signs. Maybe if your bed wants to cooperate with me. Okay. So I'm going to do blood pressure, respirations, pulse, temperature, make sure those are all in normal range. Pulse ox will stay on the whole time. Okay, and then we're going to sit you up real high. Okay. All right. So vitals were all good. Oxygen is good. Okay, so the first thing we're going to do is do patency. Can you blow in or out, please? In or out. Perfect. Then I'm going to take this. Can you cough for me, please? And I'm sorry, this is the worst part, but I need to do a gag reflex. Perfect. Okay, so. Alright, so that's all good. Okay, so now we're going to start with the NG placement. I'm going to measure first from the tip of the nose to the earlobe to the 5-foot process. We're going to say about 50. I would mark my tube. I got my lube. I'm going to go ahead and pour that out. If I had a pre-lubed tube, I would just soak it in some room temperature water. Lube up my tube. Okay, Mr. Smith, we are ready to go. Here's your water. We're going to start with you leaning your head back. I'm going to put the tube down your nose. And then after that, you're going to tuck your chin to your chest and drink your water to swallow to get the tube down easier. Okay, so head back. I'm going to have you swallow, chin forward. Good. Keep going. Swallow, drink. Swallow, drink. Swallow, drink. Okay. So if it was not at 50, I would mark my tubing again. It wasn't where I originally thought it was going to be. I'm going to temporarily anchor it to the patient. Okay. 30 mils of air in a syringe. We're going to If my patient was coughing, voice change, or I was hearing air out of the tube while I was doing the NG, I would stop, pull the tube out, and start again. Okay. I didn't hear any of that with this patient, so I'm going to listen in the epigastric region for the gurgling, which I heard. Then I'm going to take a little bit of the content to do the pH test. And that was within normal ranges. Okay, Mr. Smith, your doctor will order a chest x-ray to make sure our placement is good before we use it. Just gonna anchor this more. Okay, then I'm going to anchor it to your shirt or your gown with some slack. Okay, NG placement is done. I would do hand hygiene, put on clean gloves. With warm water and mild soap, I would clean around the tube and then do oral care if they wanted. Okay. All right, Mr. Smith, and that completes our visit. Please do not pull on the tube. Is there anything else I can get for you?
Nah.
Okay. Thank you for letting me do the placement. Here's your call light. Just gonna get you comfortable. Okay. And then I would dispose of my supplies, take off my gloves, do hand hygiene, and then I'm gonna document date and time. I used the 14 French tube. It is in the right nair at 50, and then there were no complications. Patient tolerated well. There was greenish brownish gastric secretions, about 30 mils of that, and then we verified that the tube was in the stomach with the listening of the air and the x-ray. And I would make sure that if the doctor ordered any suctioning, that was completed after verification was done. That's it.